integrated care at Neomed Echo, and thinking about how within the Best Center there are these 6 practices. So I don't know if any of these areas interest anyone.
I just have a comment regarding cultural practices. And sometimes, okay, there are some practices that have to be stopped and communicated to the given cultures. I put that post in New Guinea that they would touch and eat the brain of the deceased family members. And that was one of the ways that the Creutzfeldt-Jakob disease was transmitted. Okay, so that's just an extreme. But the thing is, we have to make sure that respecting cultural practices, okay, does not infringe on scientific medical practices.
Yeah, I think you touched on a huge topic there. I don't know if, I know this is coming out of the article that Crystal was discussing, so I don't want to put Crystal on the spot, but I don't, does anyone want to discuss or?
Well, I think it just made me think when you were talking about questions for us and other Best Center practices in regards to CBTP. They talk about culture, they talk about race, they talk about religion, and they have done really well, and initially some work out of England, and then our consultants and trainers of how do I want to frame it? We're looking at the practice and then asking them to go back. So if say they're hearing voices, for example, and this was just like a mock video, but someone hearing voices and was saying that the devil was telling her to do something nice. That's what harmful. That's what it was. The devil was telling her to do something harmful. She identified as a Christian. And so the homework for the individual was to go back to her faith leader. So in this situation, I believe it was a minister, and to talk to him. So, like go through, which, for her, the Bible. And, when you think about the devil, have a conversation with that person. So to help her, like with someone she trusted, to be able to do some reality testing with that person. And that person was able to help her see, like, well, no, usually, in the Bible, the devil was cunning, and so would come across as like, quote unquote, nice. And that's how, so because she had that person in the community that she trusted, that's where then she was able to change some of her thinking. And then when she came back to the provider, she, relayed all that information. And so the provider and the individual were able to then talk about, like, well, what does this mean? And she was able to identify for herself, well, when I'm hearing these voices, then that means my symptoms are increasing. So that the provider helped her, or the person in the community helped her see, like, no, this is not necessarily always about your faith, but she trusted that person, and then she was able to have more insight. So I think we at the Best Center are trying to look at, whatever culture means. So that can mean so many things. But we are trying to do better of really looking at how that's important to that individual and still providing the best evidence-based care at the same time.
Great. Any other questions or topics? Okay, so I can read out. So Dave Huskins, I think he put in something earlier too, just saying, agree, physicians working with population from the Marshall Islands need to sort out some legacy of environmental radiation on health and cultural perspective, which often blames legacy of atomic tests for all health issues. This includes common health issues also suffered by other populations. Cultural awareness is key there. Thanks for that. And looks like just earlier there was a couple comments too about how in mental health, psychiatrists and MPPA is often pushed into a primary care role, as many clients lack a PCP. Their only role or their only other regular physician contact is often an ER, former agency established an intensive care case management program to assist clients in accessing other healthcare providers.
One thing, can I add one thing about culture?
Sure thing, yeah.
I just looking at, I mean, certainly some cultural practices and beliefs can be deleterious and harmful. Some, I think I find in working with the Amish population, you know, you weigh the risks and benefits. And if they're perceiving a benefit from taking something or doing a treatment at a chiropractor,